Hello, everyone. Today we're going to be talking about providing holistic healthcare for American Indian Alaska Native, AIAN patients. We will define a holistic approach and explore the different elements of care it encompasses. The objectives for today's session are to describe the impact of environmental factors on health, including access to clean water and healthy food. Recognize how to integrate traditional healing practices and spiritual beliefs into treatment plans when appropriate, in collaboration with patients and tribal healers. And demonstrate a patient-centered approach that prioritizes shared decision-making and respect for patient autonomy. To provide a clear roadmap for today's discussion, let's break down the flow of our presentation. We'll start by examining environmental factors such as water quality, food access, and pollution, which significantly impact health. Next, we'll move into holistic practices, exploring traditional healing methods, cultural beliefs, and community-centered care. Finally, we'll discuss patient-centered care, focusing on shared decision-making, trust, and patient autonomy. This progression will help us understand how these elements work together to create a comprehensive approach to healthcare for AIAN populations. A holistic healthcare approach for American Indian Alaska Native, AIAN populations emphasizes a balance between physical, mental, emotional, and spiritual well-being. A holistic approach often incorporates traditional healing practices, strong community ties, and a deep connection to the natural environment. Illness is viewed as an imbalance within this interconnected system. The medicine wheel concept, where all aspects of life must be in harmony to achieve optimal health, represents this perspective. Key aspects of a holistic AIAN healthcare approach are community-centered care, which means treating the individual within the context of their family and community, involving them in decision-making and seeking support from tribal elders or healers. Traditional healing practices to include herbal remedies, sweat lodges, ceremonies, and storytelling to address physical and spiritual imbalances. Respect for cultural beliefs refers to understanding and incorporating Native American spiritual beliefs and practices into treatment plans, acknowledging the importance of connection to the land and ancestors. A holistic view of health recognizes that physical health is intertwined with mental, emotional, and spiritual well-being, addressing all aspects of a person's life. Culturally competent providers are healthcare professionals who are knowledgeable about AIAN culture, traditions, and health concerns, providing culturally sensitive care. It's important to recognize that different AIAN tribes have unique traditions and healing practices, requiring a personalized approach based on specific cultural contexts. Environmental factors have a powerful impact on the health of American Indian and Alaska Native communities shaped by historical, social, and systemic inequities. Many Native communities face severe challenges accessing clean, safe water due to aging infrastructure, industrial pollution, and government neglect. Contaminated water can lead to disease outbreaks, skin conditions, respiratory problems, chronic illnesses like cancer and kidney disease, and also contributes to mental health challenges like stress, anxiety, and PTSD. Access to healthy traditional foods is another critical issue. Traditional diets featuring wild game, fish, berries, and native plants are not only nutritious, but deeply tied to cultural identity and resilience. These foods help prevent chronic diseases and serve as a means of passing down knowledge and tradition. However, colonization, land loss, and restrictive policies have limited food sovereignty, disrupting access to these essential resources. Other environmental hazards also affect health outcomes, including air pollution from industry and wildfires, toxic waste dumping, the impacts of climate change, substandard housing, and rising rates of vector-borne diseases. Together, these environmental factors reflect a broader pattern of injustice that continues to harm Indigenous health and well-being. Addressing these environmental challenges is essential for creating healthier living conditions and reducing health disparities in AIAN communities. It requires a holistic approach that combines advocacy, policy changes, and community-led initiatives. By prioritizing environmental justice and investing in sustainable solutions, we can help restore balance and well-being to Indigenous populations. Integrating AIAN traditional healing practices and spiritual beliefs into medical treatment plans allows for a more holistic approach to healthcare, addressing the physical, mental, and spiritual needs of AIAN patients. Incorporating culturally relevant practices can foster a deeper sense of connection to their identity and community, leading to improved engagement and overall well-being in treatment. Healthcare providers should conduct a cultural assessment. Ask patients about their tribal affiliation and if they practice any traditional healing practices. Inquire about their comfort level, discussing spiritual beliefs and how they might want to incorporate them into treatment. Understand the patient's perspective on health and illness within their cultural context. Engage in open communication by explaining the potential benefits of integrating traditional healing practices with Western medicine. Discuss the limitations of traditional healing and when referral to a specialist might be necessary. Be respectful and avoid making assumptions about a patient's beliefs or practices. Collaboration with traditional healers. Explore the possibility of consulting with a traditional healer or medicine person with the patient's consent. Discuss potential ways to coordinate care between Western and traditional healing approaches. Incorporating culturally relevant practices. This includes prayer and meditation, in which you can offer space for patients to pray or meditate before or during treatment sessions. Smudging, which is the use of sage or other sacred plants for cleansing and grounding. Storytelling is when culturally relevant stories are shared to promote healing and connection. Drumming is utilized as a form of relaxation and spiritual practice. Herbal remedies can be considered in consultation with a knowledgeable practitioner. Always prioritize the patient's comfort level and willingness to incorporate traditional practices and respect individual needs and boundaries. Be aware of the diversity within AIAN cultures and avoid generalizations. Educate yourself by continuously learning about different AIAN traditions and healing practices. Collaborate with tribal organizations and community leaders to better understand local needs and practices. By actively collaborating with patients and tribal healers, healthcare providers can create a more holistic and culturally sensitive approach to healthcare that incorporates the valuable aspects of AIAN traditional healing practices and spiritual beliefs. To effectively collaborate with patients and tribal healers to integrate AIAN traditional healing practices and spiritual beliefs into medical treatment plans, healthcare providers should educate yourself to gain a comprehensive understanding of different AIAN cultural beliefs, traditional healing practices, and spiritual concepts, including variations across tribes. Attend workshops, read relevant literature, and engage with tribal communities to deepen your knowledge. Establish trust and respectful relationships to initiate open dialogue with patients about their cultural background and show willingness to integrate traditional healing practices into their care. Seek introductions to local tribal healers and build a collaborative relationship based on mutual respect and understanding. Use a patient-centered approach by actively listening to patients' perspectives on their health concerns and how they believe traditional practices can contribute to their healing. Discuss the potential benefits and limitations of incorporating traditional practices, allowing patients to make informed decisions about their care. Demonstrate cultural sensitivity in practice by incorporating culturally relevant language and terminology when discussing health concerns and treatment options. Be mindful of sensitive topics and avoid making assumptions about a patient's beliefs or practices based on their tribal affiliation. You can integrate traditional practices. With appropriate consultation, explore ways to incorporate practices like herbal remedies, meditation, storytelling, talking circles, and ceremonies into treatment plans, where appropriate. Consider collaborating with tribal healers to facilitate specific ceremonies or rituals that align with patients' needs. Incorporate communication and coordination. Clearly communicate with tribal healers about the patient's medical condition, treatment plan, and any potential concerns regarding integration of traditional practices. Maintain open communication with patients to ensure their needs are being met and to address any concerns about the integration of traditional healing practices. Remember to always seek permission from tribal leaders and communities before implementing any traditional healing practices within your healthcare setting. Obtain informed consent from patients regarding the integration of traditional healing practices, explaining potential benefits and limitations. Ensure healthcare providers receive ongoing training on cultural competency and sensitivity to effectively work with AIAN patients. A patient-centered approach for AIAN populations that prioritizes shared decision-making involves several key elements. Here's what a framework to guide this approach looks like. 1. Demonstrate cultural competence and sensitivity. Understand cultural context. Recognize and respect the cultural beliefs, practices, and values of AIAN communities. This includes understanding traditional healing practices and the historical context of healthcare disparities. Establishing trust is crucial. This can be achieved by showing respect, being transparent, and demonstrating a genuine commitment to the well-being of the patient. 2. Apply effective communication techniques. Use clear and respectful language. Avoid medical jargon and ensure that explanations are clear and understandable. Use respectful language that acknowledges the patient's cultural background. Incorporate interpreters and cultural mediators. When necessary, use interpreters or cultural mediators to facilitate communication and ensure that the patient fully understands their options. 3. Create a process for shared decision-making. Inform and educate by providing patients with comprehensive, evidence-based information about their health conditions and treatment options. Use decision aids to help them understand the benefits and risks of each option. Actively involve patients in the decision-making process by asking about their preferences, values, and goals. Ensure they feel comfortable expressing their opinions and concerns. Collaborative goal setting should be encouraged. Work with patients to set realistic and achievable health goals that align with their values and lifestyle. 4. Provide continuous support and follow-up. Schedule regular follow-up appointments to monitor progress, address any new concerns, and adjust the care plan as needed. Offer emotional and psychological support through counseling or support groups, recognizing the importance of mental health in overall well-being. Implementing these strategies can create a more inclusive and effective care environment for AIAN populations, ensuring that their unique needs and preferences are respected and prioritized. A patient-centered approach for AIAN populations that prioritizes respect for patient autonomy involves several essential principles and practices such as empowering patients while building trust and support, provide comprehensive information. This enables the patient to make informed decisions. Use decision aids such as brochures, videos, or interactive websites to help patients understand their options and the potential outcomes of each choice. Avoid coercion. Never pressure a patient into making a decision that doesn't align with their values or beliefs. Support informed choices. Provide necessary information and resources to help the patient make an informed decision that aligns with their cultural context. Building trust and rapport using active listening and give patients ample time to express their concerns and perspectives without interrupting. Show empathy by acknowledging the challenges and experiences that may be unique to AIAN communities. Establish a collaborative relationship. Clearly communicate that the provider is there to partner with the patient in decision-making. Prioritizing autonomy respects AIA and cultural values, promotes trust in the healthcare system, allows for better understanding of patients' health needs, and empowers them to actively participate in their own healthcare decisions, ultimately leading to improved health outcomes. To recap, here are the key points from today's session. Holistic healthcare for AIAN populations integrates community-centered care, traditional healing practices, and cultural beliefs. Environmental factors like poor water quality, lack of healthy food, air pollution, and climate change significantly impact health. Integrating traditional healing and spiritual beliefs improves patient engagement and well-being when done in collaboration with patients and tribal healers. A patient-centered approach that prioritizes shared decision-making and respects patient autonomy strengthens the provider-patient relationship. These principles provide a framework for delivering equitable and culturally responsive care to AIAN populations. Now, let's discuss what you can do to apply what you've learned today. Here are 3 actionable steps. 1. Conduct cultural assessments to better understand your patient's needs and preferences. 2. Collaborate with tribal leaders and healers to integrate traditional practices into your care plans. 3. Advocate for systemic changes to address environmental health disparities affecting AIAN communities. To deepen your understanding, here are some resources to explore. The National Congress of American Indians, NCAI, provides policy analysis and advocacy for AIAN health issues. The Indigenous Food and Agriculture Initiative, IFAI, promotes sustainable agriculture and food systems in Indigenous communities. The National Indian Council on Aging, NICOA, offers resources and services for older AIAN individuals. By taking these steps and utilizing these resources, you can make a meaningful difference in the lives of AIAN patients. Here are our references. Thank you for listening to this presentation.